Let's look at the cervical vertebrae. These are the smallest of the vertebrae. There are 7 cervical vertebrae. The cervical vertebrae, numbered C2 through C6, have a spinous process that is bifid, meaning it's split like a snake's tongue. C1 does not have a spinous process. The transverse process of all cervical vertebrae contain a hole called the transverse foramen. Blood vessels run through these holes on their way to the brain. There are some very special features associated with C1 and C2. C1 is known as the atlas. Notice there's no body or spinous process. C1 has a large, round vertebral foramen and larger superior articular facets. These facets articulate with the occipital condyles of the occipital bone. The atlas gets its name because it holds your head up like the Greek god Atlas holds up the world on his shoulder. The action that is provided by the joint between the atlas and the occipital condyles is the ability to nod your head as if saying yes. C2 is the axis. C2 does have a body and contains a peg-like projection called the odontoid process or dens. The transverse foramen has a hole just like every transverse foramen of every cervical vertebrae. The articulation between C1 and C2 allows for rotation of the head when looking from side to side or shaking your head as if saying no. The dens in a baby is not fully fused to the body of the axis, so if you were to shake a baby violently, the dens can break and cause serious brain damage. C7 looks like most of the other cervical vertebrae from C2 through C6, except it has a long, non-bifid spinous process. Instead, it is solid, like the thoracic vertebrae that are underneath. There are 12 thoracic vertebrae. Some key features of the thoracic vertebrae are that the spinous process is very pointy and is directed inferiorly, meaning it points downwards. The transverse process of the thoracic vertebrae are larger. They're also a little longer because this is where our ribs will articulate. There are facets on the transverse process where the ribs will articulate. There are 5 lumbar vertebrae. These are the largest of the vertebrae because they support the weight of the body. The spinous process points posteriorly, is shorter and more square-like rather than pointy. The transverse processes are not quite as long and are projected laterally. The sacrum consists of 5 fused sacral vertebrae. In this image, there are several views of the sacrum. We are going to focus on the anterior and posterior views. Different structures can be viewed based on which side you're looking at. The anterior surface has transverse lines that are formed when the vertebrae have fused together. The sacral promontory is the beginning of the sacrum. There are also holes which we call the anterior sacral foramina. On the posterior side is the median crest, formed from the fusion of the spinous processes of the sacral vertebrae. The sacral canal is an opening that runs down through the median crest and is an extension of the vertebral canal. On the lateral surface, we have the auricular process, which will join the hip bones to form the pelvis. The coccyx is the vestigial tail. This consists of 3 to 5 fused coccygeal vertebrae. The thoracic cage is formed by the sternum, costal cartilage, ribs, and the bodies of the thoracic vertebrae. The costal cartilage are what join the ribs to the sternum. There are 3 parts of the sternum. The manubrium is the top portion, the body is the middle portion, and the xiphoid process is the lower portion. The ribs have some features that we also need to discuss. Each rib has a head, tubercle, and body. The head of the rib will articulate with the body of the thoracic vertebrae, and the tubercle of the rib will articulate with the facets found on the transverse process of the thoracic vertebrae. Ribs are classified into groups. The layman's terms are true and false ribs, while the medical terms are vertebral sternal ribs, the vertebral chondral ribs, and the vertebral ribs. From now on, we are going to rely on the medical terms because many of you will go on to clinical programs, so it's important to understand the medical terminology in addition to the layman's terms. Understanding the medical terminology will help you understand where these ribs are located and how they articulate with the vertebrae and sternum. The term vertebral sternal refers to the posterior articulation with the vertebrae and the anterior articulation with the sternum. The vertebral sternal ribs are 1 through 7. The term vertebral chondral ribs refers to the posterior articulation with the vertebrae and the anterior articulation with the costal cartilage of rib 7. The vertebral chondral ribs are ribs 8 through 10. Lastly, the vertebral ribs refer to the posterior articulation with the vertebrae. These ribs do not have an anterior articulation point, which is why they are referred to as floating ribs. These are ribs 11 and 12. This ends the chapter. You are encouraged to use the learning objectives to create a study guide for yourself as you prepare for the next exam.